Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Dr. Marcie Merson, and I have to tell you, I was so impressed when I first met her. I didn't know what I was going to meet. You know, you say, oh, well, this doctor specializes, I was told that, in medical marijuana. Well, she doesn't specialize in it. This is a side part of her life because she's a pain doctor. She helps. She doesn't give you pain. She gets rid of your pain. So thank you, Dr. Merson, for being here.
Oh, thank you for having me this morning.
You know, I know you live a very busy life, and I was very impressed with you because when you hear medical marijuana, you think, okay, that's what the doctor does. No, that's not what you do. After you explained it to me, that's just one little part of your, I'd say, you have a black, you know, doctors used to carry black bags with all the things in there. That's
Exactly.
one little part of your black bag.
That's exactly right,
So,
Anita.
Why don't we start off and just say what, as a young physician, you decided to specialize in, why, and then we'll get into the medical marijuana.
Okay, so I'm an interventional pain medicine physician. I've been here in the community for 17 years. I'm on staff at the 3 local hospitals, Delray Medical Center, Bethesda Memorial Hospital, and Boca Raton Regional Hospital. And my specialty is taking care of patients who have neck and back pain and, lots of other types of complicated musculoskeletal pain and finding solutions for their issues. And those solutions, typically come in a package of different treatments, which include physical therapy, sometimes some selected injection therapies, and sometimes medication management.
And, when I first talked with you, I asked you what your designation was, and you said you were a physiatrist. And it's funny, I found out about physiatrists many years ago because as a gerontologist, I'm always interested in things, and even doctors don't know what physiatrists are. Why? It's such a great profession.
It's a terrific specialty, but there's very few of us, and most of us are concentrated up in the Northeast or the Midwest, in major cities with large teaching hospitals. But there's under 9,000 of us in this country.
Wow, that's not a lot. But here in Florida, how many? Aren't probably very many here.
I know in my immediate community, there's between 17 and 20 of us. Yeah.
Well, so let's explain what a physiatrist does exactly compared to you have a chiropractor, you have an orthopedic surgeon, and you're a physiatrist. Is there, it's kind of a mixture here?
Okay, so I'm an MD. I went to the University of Miami School of Medicine, and then I did an internship at North Shore University Hospital and Memorial Sloan Kettering Cancer Center. And then I did a 3-year residency, and my internship was in internal medicine. And so I spent a lot of time at Sloan Kettering taking care of cancer patients. And North Shore also has a very robust, cancer service. And so I spent a large part of my internship year caring for cancer patients. And as you know, pain management is a big issue for cancer patients. And so, we'll talk about the medical cannabis in just a couple minutes, but it's a really unique opportunity to help, cancer patients with their condition. And so, in addition to that, then I did my 3-year residency at Mount Sinai School of Medicine, and then in the Midwest where I got some interventional experience. And then I went on to do an additional year of training, a fellowship year in interventional pain medicine at an Emory affiliate in Atlanta, Georgia. And so I've, been on the cutting edge of interventional pain medicine, for 18 years now.
Wow. And so it must affect you to see what's happened with all the pills and all. So, I mean, I'm sure that you did give people certain kinds of, pain relieving pills in a very careful way. So I don't think it shouldn't have happened the way it's happened now. That's not what you did.
No, it's not. I've always been very conservative and appropriate in my use of opioid analgesics. And, we have, obviously a big epidemic in this country, and it's, it's been 15 or 18 years in the making, unfortunately, and, we're hopefully stemming the tide of this epidemic. And, there are legitimate pain patients who need the opioids as a class of medication. They're very effective at controlling a number of different types of pain.
Well, let's talk about some of those pain. What kind of pain are we talking about?
Okay, so there's two major classifications of pain. One is called nociceptive, and the other is called neuropathic. And, we further classify each of those into acute versus chronic. And so for nociceptive pain, what that is, like if you stub your toe, that's a nociceptive pain, and ouch. If you have an appendicitis, that's typically a nociceptive pain. So it's organ or tissue that is being impacted by, something being wrong. But neuropathic pain is one of a couple of things, and it's the more complicated type of pain because it involves your nerves. So it's either a primary abnormality of the nerves or a dysfunction in the signal processing that goes from the periphery to your brain.
That's very well said, because I was going to ask you, there are people who complain of fibromyalgia. What kind of pain is that?
So fibromyalgia is, a very complex and, somewhat elusive pain condition, but it has a lot to do with central processing and with the different receptor systems in the brain. And, it has to do, there's some association with things like Epstein-Barr virus and Lyme disease that can be primary, triggers for fibromyalgia.
So you, as a pain doctor, I always want to say physiatrist, but I'm going to use that because most people understand the other. You have people coming in, but I was impressed because it isn't just medicine. You have machines, you have all sorts of other kinds of things. So tell us, if someone comes in and let's say they've had a car, been in a car accident, and they have neck problems. You would be handling someone like that, correct?
Absolutely.
And tell us what after you decide that they are serious in this or that, what you would do. Just an example.
So typically a patient who's been in a car accident has sustained a flexion extension injury of either their neck or their low back or maybe even their mid back or all three. And that, in lay terms, that flexion extension injury is called a whiplash injury. But here's the other interesting thing that can happen. There's a post-concussive syndrome, a type of mild traumatic brain injury that can happen from car accidents. And so it's really important that, that the patient get to someone, myself or someone like myself, right away so the most effective treatments can be done for that patient. And that effective treatment can include a combination of really effective physical therapy that we do in our office, different types of techniques that we use in the clinic from a physical therapy standpoint, some appropriate medications, typically not opioids, would be appropriate in the beginning. We try to use muscle relaxants. We try to use membrane stabilizers if they're appropriate, nonsteroidal anti-inflammatory medications if the patient tolerates them, to help with this type of acute pain. Opioid analgesics, are very rarely appropriate in the beginning for a car accident patient. And
I want to ask you a question. I don't really. Where did the name opioid come from? What does that mean?
So opioids are a naturally occurring substance. They come from the poppy plant, and the original poppy plants were found or grown predominantly like in Afghanistan, is like historically where opium was discovered. And so the word
comes from the word opium?
Yeah, it does. I mean, opium is a naturally occurring opioid. Our body has a receptor system for the opioids. We have the opioids predominantly act on the mu receptors to provide the analgesia that they provide. And, interestingly enough, we also make our own endogenous opioids. So your body makes its own opioids to help to modulate pain naturally. But our body's interconnected with the environment. And so this is a receptor system that we have and a naturally occurring substance. And that's where the word comes from.
So let me tell our listeners, I'm having the pleasure, and I hope you're having the pleasure of listening to Dr. Marcie Merson. She is a physiatrist. We can call her a pain physician, but she's here in Delray Beach, and we're going to be so fortunate to have her at our upcoming Cure Symposium. We're very excited about that. She's very, very special. I have to tell you, there's a lot of kindness there as a physician, and I just love talking to people like this. So she takes her life very seriously. And I'm going to give you, I think that they can get you at 561-499-7020. Is that correct?
That's correct.
So if you are looking for a physician and you're having back pain, you're having head pain, you can get a divorce if you're having a head pain. I'm kidding. I make this light and lively. A lot of pain comes from a lot of things, but I know as people age, unfortunately, they didn't maybe take care of certain things, and it gets worse, and then they can't walk, and so go take care of it, because life now there are so many very effective ways to get yourself back, and if you have a caring physician, that's one of the ways. So again, Dr. Merson is 561-499-7020. Do you actually have a name for your medical practice? Or
we do.
What is it?
Palm Beach Pain Institute.
Oh, well, that's good. Palm Beach Pain Institute.
And it's right adjacent to the Delray Medical Center on the campus at the corner of Military and Linton Boulevard.
Right. I'm just absolutely so thrilled since I have met her. So now we're going to take the next 15 minutes and talk about medical marijuana. Tell us how, and you say, and cannabis therapy. I guess one is the same as the other.
So cannabis is the actual scientific name for the plant.
Ah.
And but most people use the term marijuana. It's the the slang term for the plant and its derivatives.
So when was it first brought to you that you thought that would be a good thing for you to start to help your patients?
Well, I mean, my interest, I've had patients now for several years who, have come to me and said, well, what do you think about marijuana? And I've always said up until, Amendment 2 passed, that, in this state it's illegal. And so I don't really have much comment. I know in California and in Oregon and in Colorado, there are medical marijuana programs and obviously in those states it goes beyond that, but in some of those states. And so, but as a physician practicing in Florida, I don't have much of an answer for your question. We have to wait and see. And, and then I guess it was 2015 it was the year before it passed. It went on the ballot and it didn't pass. So, I didn't think much of it. And then, last year in November of 2016, it passed. Amendment 2 passed. And, I had to give it some notice. And so there was, there's a certification course that physicians can complete. And, it's a very, it gives the basics of, what the state expects for the physicians that are going to be involved in recommending cannabis to the patients that they take on. But, there's so much science beyond that really basic course that, it's my nature to want to know more. And so I went to a meeting. I mean, this is what I do. I go to meetings. I learn as much as I can. I went and actually I traveled to the other coast of Florida, not the other coast of the U.S. To spend some time with Dr. Barry Gordon, who's been very very much an advocate and an early adapter of cannabis medicine in our state, and he's his primary specialty was emergency medicine, and so he opened his door January 3rd of 2017, and he's gotten really, really busy taking care of very sick patients who need this care. And I'm
going to stop you. So what does a very sick patient mean?
So, well, the Amendment 2 defines, the certifying conditions that are reasonable and appropriate for physicians to recommend medical cannabis. And so those include cancer, epilepsy, Parkinson's disease, HIV/AIDS, glaucoma, the neuropathy that's associated with HIV/AIDS, multiple sclerosis. I said Parkinson's already.
So things like that. So serious things. So I just have to ask you that before cannabis was allowed, what would you be giving them? And now you're able to do this. What's the difference for them?
Well, I'm seeing a huge difference in my patients. It's unbelievable how much relief of their discomfort, their symptoms that they get. In glaucoma patients, it's not 100% proven, but it's shown to lower the intraocular pressure. In Parkinson's patients, it can help with the dyskinesias. In neuropathic pain, it can control the pain of that the patients have been suffering with. We have other classes of very good medications, but everything in medicine has some limitation, some therapeutic limitation to it, and this gives us a new tool to go beyond what we've had, the ability to access.
So you can go back to that gentleman, to the doctor over there, but I just wanted people to understand what you're saying. So you went and you studied with him? I did.
And, I did a mini fellowship, and, and I've been practicing now. I got certified in early 2017, and, I've been, integrating it into my practice.
And you, as a physician, because you're very caring, I can see that, you feel good, don't you, when you see someone not taking the pills, which probably made them sick, other kinds of things. Is marijuana, when you're doing that, is that something that people, do they also get sick from that?
There are potential side effects from marijuana, from using the cannabis, but the majority of patients tolerate it very, very well without side effects.
And how is it given? Is it in pill form? Is it used intravenously?
Okay, so the state of Florida allows basically 3 delivery methods. One is the sublingual tinctures, which I love, the sublingual tinctures, and we'll talk about that in a couple minutes. Then there's oral capsules, and then the third method is vaping, which is inhaling a heated oil. So it's not smoking. The vapor doesn't reach the temperature of combustion. So there's no smoking, and our state does not allow smoking at all. So that's not an option.
Do they sit there? Do they lie there? What do they do? How do they take this?
Okay, so for the sublingual method, it's drops under the tongue. So it comes in an oil, and a lot of the packaging is sometimes like a little medicine bottle with a dropper, and you put the amount in the dropper, and then you put it under your tongue, you hold it there for 10 minutes or so, and then you can eat or drink normally.
Huh. It's really quite interesting. I'm so glad you're here doing this, and I know that the Cure Symposium is going to be fantastic.
It's a pleasure to be here this morning.
Good, and I can't wait for the Cure Symposium for you to talk to our crowd to do this, and hopefully you'll bring some of the tinctures, things, so that people can see what you're talking about.
Well, I can bring the empty bottles.
Yeah, empty bottles, but just show. Yeah, we're going to have a lineup of, no, but we want them to see, just like what I asked you. You have a bottle, this is the way you do it, this is what you do, because it's important. And you can also bring some other things from your pain clinic, things that, we talked about, you're a sculptor, I know you said that.
Yeah.
And to bring something to show the various parts of the body that are affected.
Absolutely. I'm working on that for you.
I'm getting all of it for you. I'm so excited. I was so happy to have met you to do this. Okay, so let's keep going with this. So now, I bet the seniors don't really understand that. They say, I'm going to be on marijuana, right? They don't really understand what this is.
So, I mean, the short answer is marijuana as a plant has 3 components, okay? The component that everybody thinks of is the THC. And the THC is the psychoactive component of the plant. So there's 3 components to the plant, and there's 2 main receptors in your body. So 3 components, THC, CBD, and terpenes. 2 receptors, CB1 and CB2, okay? So THC, the psychoactive component of the plant, acts on the CB1 receptors, which are primarily located in your brain and central nervous system, okay? The second part of the plant, the CBDs, are like medicinal. The THC is medicinal. THC controls pain. THC controls inflammation. THC has a lot of good, but it is the psychoactive component of the plant. So when people think of, the reasons that cannabis has had, a negative connotation in our society for 70 years now, they think of THC, okay? And that's just the truth of it. But, historically there's millennia of time when this plant was used medicinally before the cannabis prohibition that occurred in the 1940s. So, but we'll talk about that in a minute. So 3 components to the plant: THC, CBD, and terpenes. The CBD and the terpenes act predominantly on the CB2 receptors, which are located throughout your body. And just remember I told you that we have a receptor system in our body for the opioids?
Yes.
And remember I told you that the opioids come from opium, which is a plant?
Yes. Okay,
well, marijuana is a plant, and we have a receptor system in our body for, that the marijuana plant acts on, and this is the endocannabinoid system. And that's what the CB1 and CB2 receptors are. They're part of that endocannabinoid system. And just like we make our own endogenous opioids, we actually make our own endogenous cannabinoids. And what they do is they cause homeostasis in our body. So they bring everything in balance in our body. They actually, they've been shown to help to survey your body constantly and kill cancer cells. Although no one is purporting that, marijuana cures cancer by any stretch. I would never in a zillion years say that. Any person who has cancer needs to follow the care of their oncologist, and do all the recommended, treatments, which, might include surgery or chemotherapy. I mean, all that needs to be done, in the traditional sense. I think that, you have to remember that Western medicine exists because and we've extended the lives, we've extended the lifespan with our, with modern medicine. So if you look at something, ancient like cannabis, it has its role, but it's not the cure-all for, I want to be clear about that.
Yeah, you are, but I really did some study recently, and it does go back into ancient times.
It does.
And that's what's so amazing. And then of course we had we have recreational marijuana, and then we had just like they didn't want people to drink and all that. But I think you kind of hit on it that we don't really know what it really can do. I mean, I think we're kind of, I mean, people like you probably know a lot, but maybe there will be something eventually that people will be able to, I'm not going to use the word cure disease, but maybe put things in remission. But that's not what you do, and that's not what's should be done right now. But there could be a future.
There absolutely could be. Anything's possible. And you know what? In other countries, like Israel and Canada, there are very robust medical cannabis programs. And so there's a lot of research that comes out of those countries. And hopefully, there's going to be a lot of good research that we produce here in our country as well. What I wanted to say is, that this naturally occurring substance can offer a lot of, good to patients. And you're right, modulate the disease process for a lot of people and bring things under control and provide symptomatic relief. And I think that all of those things are very positive and beneficial.
Well, I want to just tell you that we've had you on Facebook Live, and because we're almost finished with the show, I'm finishing you there. But it's really been wonderful to have you, and of course,
lots of other types.
Gotta turn this off. The interesting thing, though, is you're going to be at Cure Symposium, and you're going to get time to do this, and you're going to bring all your little gadgets, and they're going to see your beautiful face and hear you. You're electrifying. I must tell you, I was so thrilled to have you on our show today.
Thank you. Thank you for having me and inviting me.
Right. And our next guest is a pulmonologist, and Dr. Ferraro will be calling in from, I guess he's out in Weston. So I want to thank you very much for being here, and I look forward to our Cure Symposium.
Thank you so much.
Thank you, too.